I have heard so many fascinating talks from Alan Goldhamer, but he's always in a studio and he talks about this amazing health clinic and the food and the patients. Finally, somebody invited me up there. It's Michelle Sen. She works here. TrueNorth is best known for medically supervised water fasting up to 40 days, which blows my mind. The idea is so provocative that Alan's interviews get millions of views. But I had to know, who are these patients who do this?
What day of fasting are you on?
Today is day 37.
Of water-only fasting?
Water only. I did the last few days. I have been on broth. The doctors were concerned about my sodium levels.
What are they hoping to cure?
And what brought you to TrueNorth?
Originally, 7 years ago, high blood pressure, overweight, and Hashimoto's.
What are the results?
And then sure enough, like 14, 15 day, I could see the difference. That's when I really started feeling the tumors shrinking and feeling more like softer, more like a blister. Before they were firm.
Who are the doctors that work here?
And do you often get cases of patients who've tried lots of conventional modalities and feel like there's absolutely no treatment available there for their condition, so they might as well try fasting?
Yes, probably. I want to say, I think probably like 70% of patients are here with that.
So Michelle gave me a tour of the kitchen, the food, the patient rooms, and arranged the various interviews we'll post. Here's one with Alan. Somehow I didn't come across this book until just a few months ago. My loss, 20 years, somehow I didn't know about it, and I read a lot of nutrition books. One of the things that struck me most is the idea that going without food, losing your hunger when you're a sick animal or a human, is actually part of healing. Can you talk about that a little bit?
Well, you know, it's one of the adaptations. There's a reason why almost all animals will fast when they're ill, is because by eliminating the burden of digestion and processing food, you give the body a selective advantage in terms of overcoming acute illness. So I think this is a normal adaptive process. We try to override that as humans because sometimes we let our arrogance exceed our ignorance. And so what we do is we'll
what our moms
force
told us.
people to feed, and that may actually interfere with the body's ability to deal with illness, just like a desire to interfere with fever. When the body increases, for every degree the body increases temperature, there's a tenfold increase in some of the metabolic processing. So fever is actually a biological advantage. For example, bacteria have to synthesize iron from their host. If you have an elevated temperature, it's much harder for bacteria to synthesize the iron they need. So as a consequence, you're giving bacteria a selective advantage when you take fever suppressant medications.
Yeah,
and so although those medications may make you feel better, they're not going to necessarily help you get better. So generally, we want to see fever as a biological adaptation and something you allow to run its course, even if it's uncomfortable. Now, there's limits because one of the big limiting factors in health is hydration. And so, you know, one of the great breakthroughs in modern medicine was the use of IV fluids to keep people alive long enough that the body could overcome acute infective disorders.
I see.
So you can't, especially with the very young and the very old, you can't just, you know, assume everything's always going to work out just the way you want it. But in general, fever's your friend. You don't want to suppress it. In general, the loss of appetite that characterizes acute disease is a biological adaptation and should be respected.
How'd you come across that? I mean, temperature I can understand. But it just seems so non-intuitive to say, oh, going without food is a healing process. That just doesn't seem right.
Well, you know, I got interested in this whole field by reading a guy named Herbert Shelton, who was one of the founders of the natural hygiene movement. And, you know, they looked at nature and they looked at humans and they tried to kind of make sense of it. Now, of course, we have the advantage of quite a bit more research that's been done. And, you know, if you can go to, I remember my basic biochemistry text talked about fever and iron synthesis and some of these things, you know, Boyd's chemistry book has it. So it's, I think, rather mainstream today. And as far as, I think Shelton, they were looking at animals and what animals do naturally. And that's kind of, I think, accepted and known that animals will fast.
Amazing. I have to tell you, it feels like crazy town here. I mean, I love it. I can tell your patients love it. I've talked to a bunch of them and they love it. But I just had never imagined you could fast for 40 days. I think that's why your Rich Roll interview got 3.6 million views, is it said, can you water fast for 40 days? And it's like, who does that?
Well, Moses, David, Elijah, Jesus, and apparently a bunch of our patients too.
Yeah, but Gandhi only made it 21 days for his longest fast.
Yeah.
And not many of your patients are Jesus.
No. I have had asked people if we also teach them how to part the Red Sea, but it's all in the wrist.
That is funny. So,
and not everybody needs to fast 40 days. You know, the majority of our patients are fasting much briefer periods of time, anywhere from 5 days to 2 weeks to 3 weeks, depending on their condition, their reserves, and their situation. So it's a small percentage of people that need to fast for the very extended periods of time, like 40 days. But certainly we have a large number of people that have done it successfully.
We interviewed a couple today that are on their 37th day, and they're happy. They're walking around like...
Right, but we have maybe 70 people here, and only a few of them are fasting 40 days. You have a whole lot more that are only fasting 4 weeks or 3 weeks. Or,
Makes
so
sense.
it's important for people to understand that the duration of fasting is dependent on your actual needs, and you don't know that exactly until you see how you do fasting.
I see.
So we never know exactly how long a person should ideally fast until you see how it goes. And you don't want to fast people longer than they should fast, because that can result in a problem. A big part of what we do here at TrueNorth Health is make sure that people fast no longer than is safe and appropriate. And we know we've done that successfully because we've done it 25,000 times over the last 40 years. And so far, everybody that's walked in has been able to walk out.
That's kind of amazing to me. I don't know how that is possible, because I see some of the people that walk in here and they're pretty ill.
If you do the calculations, just patient days average, we should have had 12 people die over the last 4 years just by random chance.
You would think.
So what it says is that this approach is actually safer than background living.
That's amazing.
And in a way, it should be, because people are not getting run over by cars, and they're not, getting shot, and they're not, there's a lot of things that don't happen when you're in a controlled setting. So you would expect a better outcome than background living. But the point is, it's obviously inherently safe. And now we've done a fasting safety study where we've really systematically looked at fasting safety adverse events and be able to show that when it's done according to this protocol, it can be done safely and effectively. And the protocol means screening patients so that you fast the appropriate people, monitoring patients so they're fast appropriately, and most importantly, refeeding people in a controlled way so you avoid refeeding syndrome and the other theoretical problems that could come up with fasting.
And you got your training in Australia for all this, right?
Well, I went to chiropractic college in the United States. I went to osteopathic college in Australia, and I studied with a guy named Alec Burton, who was at the time the most experienced person on fasting. And he was fabulous because he showed me how to use fasting to help people get well.
He's got a great sense of humor, too. I've seen a couple of his talks. Alex and his wife...
Nejla.
I wondered how you pronounce that. It's an unusual spelling. Their book seems to be copyright 2018, and Campbell wrote the foreword for that. And he gave quite a testimony of the 2 fasts that he did here. I was really surprised to see that dioxin exposure was... Can you tell his story? He was losing his speech, right?
When we met Dr. Campbell, he was having some very serious problems, including difficulty with loss of speech, and dystonia was the diagnosis. And part of his story was he was the first scientist to isolate dioxin, the active agent in Agent Orange. And at that time, they didn't know what its full effect was. And as a consequence, he got dramatically higher background levels of this toxin and developed a progressive neurological symptoms and decided to come in and undergo fasting. And fortunately for us and for the world, he did very well, and he continues to do very well as a consequence of fasting. What fasting does is it helps to mobilize and eliminate various types of toxic materials, particularly those that store in the fat, and process and eliminate those. So overall body loads drop. And then fortunately...
And that happens in the first few days of the fast, mostly?
Well, actually, it becomes geometrically more impacting as you get farther into the fast.
Why do people feel ill oftentimes feel ill in the first 72 hours?
Well, essentially, many people are toxic waste dumps. And so when they start mobilizing and eliminating these accumulated intermediary products of metabolism, they'll get symptoms like their mouth will coat up and taste like something crawled in there and died. And they may have nausea because their liver's dumping massive excess amounts of bile, that yellow-green pigment, which can cause vomiting. You can get skin rashes, we call fasting rashes, discharge from the mucous membranes, low back pain, headache, irritability, sleep disruption, all kinds of what I call entertainment. And so it's not always pleasant. However, what's interesting is if you look at the patients, the people that work here and that fast every year periodically, preventatively, they generally have very few symptoms. So it's what I call boring fasts.
Oh, I see.
Because people that eat well and live right don't often have the intense detoxification symptoms that people that perhaps are coming off medications or have been eating a greasy, fatty, slimy, dead, decaying flesh diet with its biologically concentrated amounts of poisons. And so when they fast, there's so much stuff that's coming out, it can make them feel somewhat unpleasant.
I see. You still screen patients, right?
I do.
A lot of patients. How many do you screen a week?
I talk to upwards of 200 people.
How do you do that when they probably want to talk about their problems for 2 hours?
I'm fairly focused. And also I have extensive information that I've collected and on them before they fill out. The way it works is they go onto our website, they fill out the registration forms, which gets me their medical history. So I've reviewed their medical history when I call them, and I tend to be focused on the things that are most relevant. If in fact we can screen them and that we believe they're a good candidate for coming in, when they come in here, they'll have an exhaustive medical history exam and laboratory workup with one of our physicians they're attending. My job is just to eliminate people that are not likely to have good outcomes or that aren't appropriate candidates for this kind of environment. And I've done it a lot, and I can do it rather efficiently.
So who are those people? Kidney disease?
People that have diseases that would prevent them from fasting, people that have psychological challenges that would prevent them from playing nicely in a group setting, people that have excessive fear because they don't understand what's really going to happen, or people that are looking for magic, looking for something that's going to allow them to regain their health without having to actually pay the price of living healthfully. Since health results from healthful living, and healthful living involves diet, sleep, and exercise, if you're not prepared to make lifestyle changes, the likelihood of long-term success is low. And we're mostly interested in getting people that are going to have a good long-term outcome so they make us look good.
I've heard you say in your other talks that determination is like one of the top things.
Most important part of fasting probably is appropriate refeeding after fasting. That's where you can either ensure success or can really get yourself into trouble. And that's the mistake that most people make when they're doing fasting on their own. They make a few fundamental mistakes. Some people fast that shouldn't fast because they haven't been screened. Some people fast, but they don't rest enough, and so they will get problems with hydration. And that can be a problem. They're not being monitored, or they get into panic, or they get symptoms and they go to a well-meaning but misguided physician who doesn't understand fasting and then treats them and actually creates problems rather than solves problems. Or they come off, they're too active during fasting, which also leads to hydration, or they come off the fast inappropriately and haven't really escaped the dietary pleasure trap fully. And as a consequence, they get themselves into trouble because they're eating inappropriate foods or coming off the fast too rapidly.
So I'm a little bit gobsmacked about, I would have thought the muscle loss would have been obscene.
Yes, that would be the obvious intuitive thing, but we just did a study using a DEXA scanner to authoritatively determine what actually happens to body composition during fasting. And now we know what happens. When you go on a fast, you lose a certain amount of weight. Let's say you lose 20 pounds. When you come off the fast, you regain weight. So let's say 10 pounds. When the weight you lose in fasting includes muscle, fluids, fiber, and fat. And of the fat, it's fat in general and specifically visceral fat, the type of fat that accumulates around your organs and in your belly. When you come off the fast, you regain water, protein, glycogen in your muscles, and fiber, but you're not regaining fat. In fact, you're continuing to lose fat.
That's crazy.
And in fact, at 6 weeks after fasting, the people in our study had a higher lean tissue mass than they did at baseline.
That's crazy.
The same bone density, but continued to lose fat and visceral fat. And now we have 1 year follow-up data that shows that people can not only do it for 6 weeks after fasting, but they can sustain their weight loss, their blood pressure-free state, drug-free state a year later. And what's interesting is that 77% of that particular study were able to maintain weight loss and blood pressure-free state a year later, which is far higher than what we actually had predicted.
That's crazy. And the reason it's so crazy to me is you hear gerontologists all the time, and the literature's full of the sarcopenia, or the muscle loss that happens in hospital visits. Just a week for someone who's elderly, if they don't have an exercise bar on the bed above the hospital bed or something like that. And so I've heard gerontologists say muscle loss goes in step, sequence. It's not a linear decline, and the steps are when you go to the hospital and you can't exercise. So you're telling people to rest and not exercise.
Well, but you notice the people are not getting the pathology of bed rest from lying in bed and not moving around like they might in a hospital setting. They're still moving around. They come down to lectures. We just don't want them doing vigorous physical exercise during fasting, because then the only place the body could get that extra glucose needed for the muscle and brain activity would be from a process called gluconeogenesis, which is the breakdown of protein. one of the reasons why our people's lean tissue is higher 6 weeks after fasting than it was at baseline is because they minimize protein loss during fasting by taking it easy, and then they maximize lean tissue gain while they continue to lose fat during appropriate refeeding after fasting. The exciting thing is that people can do that not just for a limited period of time, but it appears that highly motivated people can do it indefinitely. And so now we see people here 30, 35 years in who are not only doing well themselves into their advanced age, but they've outlived everybody they know, in some cases even their children.
Yeah, talk about your mom's advice.
My mother, when she was 92 years old, realized that all 52 of her most dear, closest, lifelong friends had all died, that she was the last one standing, so to speak. And she said that it was very difficult to make new friends in her 90s because she said even people 10 years younger were still too old to do the stuff that she wanted to do and play bridge and carry on. They were all busy with their illnesses. And so she said that I needed to warn my patients that if they were going to insist on doing this type of a diet, make younger friends. And she said, not just a little bit younger, a lot younger.
That's funny. I really love that. So you monitor electrolyte levels, and if sodium gets too low, is that the key one?
Well, we monitor a number of blood variables. Amongst them are kidney function, liver function, and electrolytes. So electrolytes include sodium, potassium, magnesium, chloride, calcium. All of them, are important. Potassium and sodium are probably the most known and most obvious, and we have specific standards that we use because they are more sensitive than other nutrients might be in terms of rate limiting. So if we monitor those and don't supplement those, we can be confident that the other things we're not monitoring are less likely to have a problem. If you just say somebody's potassium went low and you just gave them potassium, well, that doesn't guarantee that 15 other things that you're not monitoring aren't out of whack. So by identifying the nutrients that we can monitor and using those as rate-limiting nutrients, we can safely conduct fasting for long periods of time, as we've been able to prove.
So why do some people's electrolyte levels get low enough that they have to drink the broth?
Well, think about it. There's big differences between one person and another in terms of their reserves, their storage, their disease, their kidney function. In other words, let's say, for example, you have some kidney disease. You may not recycle as well. If you have diarrhea during the fast, or you have vomiting, that can deplete reserves. Somebody that's very young or very old may not have the same capacity as a person in their middle years, the 20 to 60-year-old or 27-year-old range. Some people have just biological differences in terms of, how well they, like why are some people taller and some people shorter and some people gain weight easily and some people, don't gain weight easily. These are all biochemical individual variables. And so we don't know for any given individual what their sensibilities are, which is why we monitor people. We do history, exam, lab, and careful monitoring. And we do that frequently enough based on our experience that we're going to catch issues that are going to be a problem.
So then you recommend a salt-free diet, an SOS, salt, oil, sugar.
We advocate a diet free of sugar, including refined carbohydrates, but you still get enough carbohydrate from your diet, from whole foods. We recommend no oil, but you still get your essential fatty acids from your food because the diet's not fat-free, it's just oil-free. And we recommend a diet without added salt. All whole natural foods have sodium. And it turns out, if you eat a variety of whole natural foods, you get all the carbohydrate, all the essential fats, and all the salt that you need. You don't have to add additional salt.
Is that true for athletes? Endurance athletes run the Western States 100?
It's especially true for athletes. Now, just like pregnant women, athletes need a higher caloric intake to make up for the race, but they don't need a proportionally different diet. A pregnant woman may need 600 additional calories a day, but 600 calories of highly nutritious, high nutrition density, low caloric density foods will meet that pregnant woman's needs. And it's just like an athlete. Yes, an athlete is going to need to eat more calories. And if all of their calories come from whole natural foods, they're going to get the quantity and quality of nutrients they need. Now, it's true. Athletes, for example, that are doing a lot of sweating are going to have a higher turnover rate. But then you would compensate that for giving them electrolyte-rich whole natural foods, whether it's fruit or vegetable juices or whole fruits or vegetables, or depending on how you design the diet. Because their caloric needs can be so much higher, sometimes we use a little bit more processed whole natural foods than we would, say, in a person trying to lose weight.
I see.
So instead of carrots, we might give them carrot juice. Instead of giving them steamed vegetables, we might give them some soup, just to be able to get more caloric density into the feeding bag, so to speak, within the 8 or 10 hour feeding window that we're allocating people to do that.
So one of the reasons I asked this question is something happened to me. You know more about electrolytes than anybody I've ever talked to before. But I used to do Ironman competitions, and it's hot. And I happen to sweat a lot. I guess it's a genetic thing. And I have a lot of sodium in my sweat. I guess that's a genetic thing too. My clothes go white after. And I was doing ultra runs and so on. And one Saturday I ran to the top of Half Dome and back. And I did a lot of sweating. It was a hot day. And then I just felt off on Sunday. I just felt like, ooh, lightheaded. Stand up and I couldn't see very well. And then Monday I just could not stand up. And just everything was going dark. And I got to the emergency room and collapsed and vomited and everything. And they started screaming. I couldn't see. They started screaming and saying his blood pressure is below 60/30 or something like that. And they rushed me off in the emergency room. I was there for 6 hours. They thought I had cardiomyopathy. And I was 3 days in the cardiac intensive care unit. But they gave me 2 bags of IV while I was in there. And then I ate hospital food while I was there. And I came out okay. And I always thought, you know, I went with a very low salt diet on recommendation by Dr. Furman. This was 25 years ago. And maybe I overdid that, given how much I sweat.
It's more likely that your symptoms might have been associated with low glucose levels, because, you know, the blacking out and all that stuff.
Yeah.
So you may have also had a virus. You may have had something going on in your GI tract. Lots of different possibilities. Eating a lower salt diet may not have been even.
What is hyponatremia? Is it drinking too much water and not enough sodium?
So if you drink large amounts of water, you can flush your sodium out. That's why even in fasting, we want to do minimum and maximum levels. So sometimes when people are exercising vigorously and they drink large amount of uncompensated water, they can flush out their electrolytes and get into problems. But that's why, for example, let's first of all be clear, marathon running may not be a natural behavior to begin with. So in order to compensate for that, we have to find carbohydrates in a form we wouldn't necessarily we wouldn't normally use concentrated carbohydrates, but you might in an athlete take dried fruits, these kind of things. And also you might need to have a higher fluid and a higher electrolyte intake, but you wouldn't necessarily need to add salt to do that. You can use tomato, celery, beet juice. You can use fruit juices. There's lots of ways to keep people hydrated, get them glucose, get them electrolytes. So I'm not saying you didn't run into an imbalance, but it may not be the imbalance that you're thinking of. And the answer wouldn't necessarily be taking salt tablets and things of that nature. Having said that, though, if people have underlying pathology and they're not utilizing, recycling their electrolytes well, and they get into a deficit, sodium is an essential nutrient. Without enough of it, you die. So not a good thing. Glucose, if it gets too low and you're not able to process it, that can cause very serious symptoms. And the same thing with other issues. So I don't know, though, for example, if you had taken a whole bunch of salt during your run, you necessarily would have avoided that particular issue. You don't know.
You know, it's funny. In most American ultra runs, they have salty snacks and you can't carry all your food. So you're eating the salty peanuts and things like that. So I never really had a problem with it there. But in the Comrades Marathon in South Africa, it's 56 miles and it's 80-something degrees. So you're sweating a lot. The food that the athletes eat there are root vegetables that poor people are bringing in cardboard boxes from the townships. So you just reach in there, I don't know what that is, it looks like a sweet potato to me, and you eat that. But it's not the normal salty food that you. So 2 people died of hyponatremia the year I ran it, and I noticed last year that 2 people did it again. And why does that happen at the Comrades? Because the Western States is 100 miles and it's hotter. Why does that not happen there? And I wondered if it had to do with you're just eating root vegetables and they don't have enough concentration of.
Yeah, I wonder if there's other possible explanations. You know, it's really hard to, without actually knowing the individuals, because you don't know what the underlying pathology is. You don't know what medications or other complications may be going on. I'll give you an example, though, of how confusing it can be. We had a patient here one time that came in from one of the out of country and was on some very powerful cardiac medications, but they weren't responding the way that we thought they should. And normally we're in the process of getting people off their medication. This person on high dose medication didn't make any sense. Well, we replaced the medication with U.S. medication, same thing.
Yeah.
Completely different response because
yeah.
what they were taking was
Interesting.
It had nothing to do with.
Oh, interesting.
So
Yeah.
sometimes it's not intuitively obvious. The fact
I
that
see.
people die doing some extreme sports, particularly if they're unconditioned athletes, and
Yeah.
may happen though, regardless of
Yeah.
the
It's
sodium
kind of a
and
crazy
potassium
thing
variables.
to do. My cardiologist
Right.
said, "You're so lucky you don't have AFib from everything you've done."
What I would be interested though is looking even in yourself when you look at your blood values. I'd like to see what the blood values were when they saw it when you went in the hospital. Because if it was
Yeah.
low glucose, that's going to be different than if it's low sodium. These
yeah,
are
we
measurable.
had trouble getting the
phenomena.
medical records because it was a Kaiser hospital, and I wasn't Kaiser, but I was so desperate. I went into the emergency room, and they took me because I was dying. But then we never got the records from them, and they must have had electrolyte concentrations.
Yeah, it would be
from-
really interesting to see
Yeah.
what actually was going
Yeah,
on,
yeah.
because then you might be able to unwind where the deficit was.
I've always wondered. But in the meantime,
but-
while I do sweaty, hot exercise, I've been popping salt pills because I just got scared.
Right.
Not that I'm knowledgeable, just
Right.
scared.
The point is that you can get a high sodium intake from whole plant food sources too.
Yeah.
Things like celery juice and tomato juice.
I didn't
and
know that.
Beets are very high in sodium.
Yeah.
Well, you can taste it. It's pretty
Well, I drink V8 juices on these races now, but they're like crazy,
yeah,
980
yeah.
milligrams of sodium.
Yeah, and you can get into problems from too much as well as
Yeah,
too
yeah.
little. So I wouldn't
Yeah.
necessarily recommend that particular.
So are you shocked at the number of conditions that turn out to be applicable to
Well, when
fasting?
you really think about it, why would anything respond to nothing? Why would fasting be helpful for anything? Well, the conditions that fasting is helpful for are the conditions that are generally caused or aggravated by dietary excess.
Yeah, yeah.
So when you talk about obesity and cardiovascular disease and diabetes and autoimmune disease and cancer, you realize all of these conditions are strong evidence that dietary excess is associated with their problem. Basically, here's what happens. People get caught in the dietary pleasure trap. So the brain is being fooled by the artificial chemicals added
Yeah.
to the food, the salt, oil, and sugar, so they overeat. And they become fat, and part of that fat is visceral fat. The visceral fat produces inflammatory markers that cause heart disease, diabetes, autoimmune disease, and cancer. So it's not shocking that when you do the one activity that preferentially mobilizes visceral fat, that's water-only fasting, and you get rid of the visceral fat. So even in a 2-week fast, you can eliminate over half of a person's
That's amazing.
visceral fat load compared to 20% of their total fat load. So it's really remarkable that they would respond. It's
I know.
not surprising. Now, it's interesting. Conditions that have nothing to do with dietary excess often are not the conditions that respond particularly well to fasting. So what we've got is a ancient practice that deals with a modern problem of dietary excess. People didn't used to get those diseases. Those were called the diseases of kings.
I know.
Because it was only the wealthy elite king that could afford to eat the diet that caused the problem. Now, everybody's living like a king, and as a consequence, you've got a lot of diseases of dietary excess. Fasting works on the 80 or 85% of the problems that are actually killing people prematurely. It may not work on everything. It may not be for everybody. But where it's appropriate, there's nothing else that I know of that works as well as fasting.
Well, I expected it to work for blood pressure, and I bought what you said in the pleasure trap, that for blood pressure, it's the runaway king of controlling your blood pressure. And I've interviewed a couple of your patients and talked around here. It's amazing what happens to their blood pressure. I mean, that's astonishing. Type 2 diabetes, I thought also, because that's kind of mostly a weight loss thing. Roy Taylor in the UK has shown that almost any diet if you lose enough weight. But I did not expect dioxin exposure and some of the other things.
Well, when you think about, especially poisons that tend to accumulate in the fat, because the fat's preferentially mobilized, it would make sense that total body loss, and they've done it with PCV poisoning in their studies. So that kind of does make sense.
I see.
It's interesting in conditions like lymphoma
Yeah.
that you wouldn't normally expect. In fact, in the patient that we published in the British Medical Journal,
Yvonne Bellman, we interviewed her a week ago.
well, her doctor said, "Oh,
That's determination. She's got the
diet didn't matter."
Yeah, I know.
They discouraged her
I
from
know.
doing some quack diet. That diet, she could eat whatever she wanted,
Yeah.
as long as she didn't lose too much weight.
Yeah.
There, it's going to be a little bit more surprising, but it's not surprising to us because, again, the autophagy changes, that the self-eating mechanism of the body enhanced with fasting, the microbiome, the 5 pounds of bacteria that live in your gut that swim around in there, pooing
Yeah, yeah.
TMA in you and
Yeah.
whatnot. So normalizing your gut microbiome stimulating autophagy, detoxifying the body from the cumulative materials it makes sense to us that that might boost the immune system and allow the body to do what it does best, and that's heal itself if you get the heck out of the way.
That's amazing. I have a couple of case studies. So now that I know about you and your book and so on, whenever I talk to somebody who's ill, I think, I wonder if I should have them go up to TrueNorth but I'm not sure I understand the screening criteria. So let's take some examples. I have some examples. Mikhaila Peterson, she's got almost 1 million Instagram followers. Every YouTube she does has greater than 1 million views. Her dad is Jordan Peterson, the famous psychologist, and so on. So she had terrible rheumatoid arthritis starting at age 2. She was diagnosed officially at age 7. She had a hip replacement at age 16. So she tried various plant-oriented diets, like a gluten-free diet. I don't have details on exactly what she tried. There could have been processed food in there. So she switched to a carnivore diet, complete remission, just complete remission. And all she eats is beef and salt. And she's done that for 6 years. She looks beautiful, no symptoms whatsoever. How do you talk to somebody like that and say,
well, you have to remember that
you should have come to TrueNorth?
What's good for your short-term symptomatic relief isn't necessarily the same thing that's ideal for long-term health maintenance. And we know that people on high-fat, high-protein diets in the long run oftentimes have significant consequences. Now, that may be less bad than the diet that refined carbohydrates and other things that were specifically antagonistic to her. But a better strategy in our experience with autoimmune disease, including rheumatoid arthritis, is a whole plant food, SOS-free diet. Now, it may be that you have to do things to get the person to be able to handle that diet. The nice thing about a animal-based diet is that there's not the dietary antigens that are present in the plant-based foods that might be triggering.
What does that mean,
symptoms.
antigens?
Proteins that stimulate an immune response. For example, a common antigen is gluten. 1% of the population, if you feed them gluten, they'll get what's called celiac disease, and it can be a deadly disease if it's not addressed. Another percentage of people, instead of the immune system attacking the intestinal tract, it'll attack the thyroid. It's called Hashimoto's thyroiditis. So it's an autoimmune disease where the thyroid is attacked, stimulated by the proteins found in things like wheat, rye, and barley. So those patients do a lot better without the wheat, rye, and barley. Some people have really messed up gut leakage problems, and almost anything will stimulate an antigenic response. And so when they go on the animal-based diets, at least at first, they feel much better because they've eliminated the sugar, the oil, the salt, all the other, whatever it is that's been irritating them. But I would challenge you that if you look at cultures, populations that eat that diet, like the Eskimos, by force of access, their average life expectancy is in the late 30s, early 40s. There's serious cardiovascular consequences. Don't show up right away, but they will show up long-term. So we would argue that what's good for you today symptomatically isn't necessarily the same thing that's going to allow you to live a long and healthy life.
So with autoimmune diseases on a plant-based diet, do you have to do some kind of elimination? Are there certain plants? You mentioned gluten.
Well, we don't use gluten with anybody, even people that aren't sensitive.
I toured your kitchen. They said,
and we don't use dairy products with anybody because we think that's like gasoline on the fire of inflammation.
What about things like tomatoes that some people have?
There are people that are sensitive to probably almost any food. And if people have sensitivities, we would withhold those foods until they no longer have those sensitivities. But we have a huge advantage here because when we bring patients in, they're often able to go through periods of fasting. And after fasting, the gut leakage often heals. So now foods that they couldn't eat before, they might be able to, maybe they can't eat it every day, but they might be able to rotate that in the diet without necessarily manifesting problems. Or just eliminate the class of foods they're sensitive to. Most of these foods are families of foods where there's proteins that are common in the families, like the nightshade family, whatever. So if a person is sensitive to that family, just don't eat that. We'll eat the other foods.
How do you determine if they're sensitive to that family?
There are testing you can do that's expensive and not that accurate, or you can do rotational feeding after fasting, which is what we do. We'll watch
you do it
see how they respond.
I see.
It's not rocket science. This is often many people have noticed every time they eat tomatoes, they get a rash, or they get so we just hold off on those. We don't believe there's any one food that's so critical you can't work your way around, or a class of foods. You're lectin sensitive? Well, don't eat grains and beans. We'll just have more starchy vegetables. We'll find other things that you can eat.
I see.
That you seem to thrive with.
I think I heard you say with lymphoma, there wasn't much of a treatment for lymphoma. So
there's all kinds of treatments. They just don't work very well. They don't necessarily make people live longer. So they don't affect all-cause mortality. They have terrible side effects. And so a lot of times they'll watch and wait, trying to avoid the side effects until absolutely necessary.
I see. Yeah, so Yvonne said her dad went through chemotherapy and she got so terrorized by that, she just was not going to go chemotherapy. So you were kind of her court of last resort, and it worked.
Well, she was willing to do dangerous and radical things. She was willing to eat well, exercise, go to bed on time, and undergo fasting.
Yeah.
And so, that made her a really good candidate because she was willing to do those really extreme kind of
Extraordinary
interventions.
things.
And even though
Scary.
her physician at first was antagonistic, I think you'll find now he's much more supportive since, it's very rare for doctors to get to see people actually get well. In fact, that's one of the things the residents say here when they're doing their rotation and training here is that, wow, I've never seen that kind of condition get well before.
So have you had success with other lymphomas? With other
Yes, in
lymphoma
fact,
patients?
we have patients here right now that are doing
talked
well.
to a few, yeah.
We have one gentleman here right now. This is a 2-year follow-up. He's done very well, good
Yeah.
CTs. He's currently doing a 40-day fast, and we're hopeful that we'll see good long-term results, and we're going to be publishing a cohort of these studies, and eventually we'd like to do a clinical trial. And that'll really piss people off because we'll be able to show in a way that's very hard to argue with.
So what about other forms of cancer, melanoma, and so on?
So right now, the only thing we were publishing on is lymphoma and some leukemia. We're not publishing on solid organ tumors or discussing that.
Okay. So if I were to approach you and say, I've already had 6 basal cell carcinomas and squamous cell carcinomas and all that, I got a skin graft on my nose and all that kind of stuff, could you say if fasting is beneficial for that?
Well, what we can say is that health results from healthful living. So we'd want you to live healthfully, diet, sleep, and exercise. That we believe that the people that get the most benefit of fasting are actually healthy people that are using it preventatively. So although I don't have data to tell whether fasting will prevent you from getting recurrence or new basal cell carcinomas, there is no contraindication to using fasting, diet, sleep, and exercise to keep you healthy. But I'd also recommend you wear a hat and use appropriate clothing because excess sun exposure may be a risk factor, particularly when
fair freckled skin, blue eyes, red mustache.
Right.
Yep,
and the diet itself, also affects your vulnerability.
Well, I eat your diet.
We don't ignore the fact that we don't want people burning their skin and stuff like that.
Yeah.
We don't necessarily like the ointments as a first line of defense. We'd rather use appropriate clothing and and that kind of thing. And also, that's an area where there's evidence that by early detection and removal of local lesions before they disseminate, that might make people live longer better. So there's an example where medical treatment might actually have some utility. The best solution, prevention.
Yep.
The next best solution, do the diet, lifestyle, exercise, and then do appropriate treatment as necessary.
Yeah. Okay, so next candidate, we have a close, someone close to us who's in his 30s. He looks like the model of health, has a PhD in biology, is normal weight, is a lecturer at UCSF or San Francisco State, I don't know. And he got adenocarcinoma of the small intestine. He had some surgery. He has some mutation that makes it so it's not treatable by immunotherapy. He's had multiple bouts of chemotherapy. And I don't know, do I have him go fill out the form on your website, or is that the kind of patient you screen out?
Well, it would be, no, by condition, that's not a problem. It's a question of what's his motivation. If his goal is to get as healthy as possible, he's willing to make diet and lifestyle changes, then we would certainly encourage him on that. If he's looking for some magic cure for adenocarcinoma, we don't have data to support that what we do is going to solve everything that ails him. So it's now a philosophical question is, can we do things to improve his overall health with the hope that perhaps that gives him a better long-term outcome? We don't have data specific to his condition.
I see. So he just got married to someone who has another terrible condition that I didn't even consider would be treatable at TrueNorth. She has terrible vertigo and gets headaches. Now you're smiling. I met a couple other patients here. And terrible headaches, I think?
There's lots of causes, though, for headache and cephalgia. And so...
Cephalgia? What's that?
Or head pain.
Head pain.
Just the fancy word for headache.
Spoken like a doctor.
Yeah. Alga's pain and stuff for his head. And so, But the point is, when people say headache, that means different things to different people. So there's vascular headaches, there's tension headaches, there's cluster headaches. There's lots of different kinds of headaches. Many of those kinds of headaches respond to the type of comprehensive approach that we do. We look at the mechanics, the chiropractic osteopathy, acupuncture stuff. We look at the diet, can often be a trigger with migrainous headaches particularly. And we look at fasting, which is really quite remarkable. We have a published case report of a dentist who had 16 years of constant daily head pain after a traumatic mechanical trauma, a dural tear and inflammation, who fasted for 41 days, got dramatic improvement, refed, then did another 40-day fast. And now it's 12 years later, she's not had a headache for 12 years. So, you know, this, and she went through absolute agony for 12 years. So in her case, it happened to work really well. But I've also had people with chronic headaches that we've done everything right and still they're suffering with headaches. So it's not like it's an absolute universal resolution. It's not like blood pressure where we took 174 people in a row and 174 people achieved. So headaches can be more problematic, but a significant majority of the people that we see experience enough results that they feel like that was a really worthwhile attempt in their evolution of getting well. You know, as a chiropractor, I see a lot of people with headaches that respond to mechanical treatment. The ones that don't respond to mechanical treatment will oftentimes do fasting and other things. In fact, it's interesting, the chiropractors here say if you get a patient with a problem, you want to treat them right away, because if you wait till they're done fasting, there may be nothing left to have to treat. So much stuff resolves itself before we even get a chance to work on it, just by detoxifying the body, giving the body a chance to recalibrate.
Amazing. So now I have a tough case for you. He's been a patient of Caldwell Esselstyn's for, I don't know, 30 years or something like that. He went into Caldwell originally with angina, and the diet worked for a while. And he swears, I know Doug Lyle says people lie, but he swears that he does not touch any animal foods and that he's very religious about his diet. But now he has 90% blockage, and he's facing a bypass operation.
Well, you know, I think he should go back and visit with Caldwell and talk to him about the particular diagnosis. For example, if he has 90% occlusion, he may have corollary circulation, so that the idea of a bypass may or may not even be relevant. If he's not got unstable angina, then there's probably still an opportunity to see stabilization or improvement. And remember, it's not just diet. Now, first of all, a lot of people that are diligent about their diet may not be diligent about their diet quite as diligently as you or I might think, is necessary, particularly to reverse disease. Second of all, there's exercise, there's sleep, there's stress. There are genetic variables that make people more vulnerable. And then there's something that's very powerful, which is called fasting. So if you have an individual that has the capacity to do fasting, oftentimes you'll see significant improvements. And we see people consistently in here with stable angina that will do nothing but fast and see, improvement and reversal. So I don't know whether this particular individual will respond, but it would certainly be worth a consideration.
Improvement and reversals. What does reversals mean?
Reversal means that if you were to go in and do
measure
examination,
the
you'd see, like Dean Ornish did in 1980 in his study, show that the process actually reverses. It doesn't just stabilize, it'll sometimes actually reverse.
More so with young people than old people, right?
Yeah, but we've also seen older people do very well. And so you're making an assumption right now that we're getting excellent dietary and lifestyle compliance, and we may be. There are people that have very difficult problems. But most of the time when we unwind those, like for example, they'll tell us that, and then they come here and we do exactly what they're supposedly doing at home. We're seeing the 2 pounds a week for weight loss, and we're seeing blood pressure coming down, and we're seeing. So I remain skeptical. Okay.
Michelle told me that you're very skeptical about that because you've seen 20,000 people. You know how people are. So.
Yeah, I mean, that's why you notice we have quite a bit of security cameras and infrared video and stuff. Because if I see data that's not consistent with my expectation, I want to make sure. I want to know. Usually we can find an answer.
Fascinating. That's fascinating. So Doug Lyle said something interesting on Chef AJ 3 months ago. He's pretty blunt. And he said, on Chef AJ, I have high cholesterol. It's 220 to 250, but it's endogenous cholesterol. And I don't eat any animal products. So for me, I don't need to take statins. It's not a concern. It does not build up atherosclerotic plaque. And my C-reactive protein is 0. And he said, if I went in your city, AJ, and Chef AJ, and asked 100 cardiologists what to do, they would tell me to get on statins. But I don't need statins, and they're morons. That's the word he used.
Well, what I think is they're well-intentioned, but maybe haven't read their own literature as carefully as they might. Because if you look carefully at the literature, you'll find that the use of statin medications isn't as associated with reduced all-cause mortality as people are led to believe. That if you look at Dean Ornish's data, that cholesterol wasn't a particularly good marker. What was a good marker for progressive atherosclerosis was the diet. That some people on a very good diet have very low cholesterols, okay? But some people have higher cholesterol because they endogenously produce more cholesterol. But that doesn't mean they're plugging up their blood vessels with fat. What predicted whether the vessels plugged up or opened up was the diet. And so even people with a low cholesterol level can still be plugging up their blood vessels with fat or shunting cholesterol to the colon and being at risk for colon cancer and other problems. So cholesterol is just one, for epidemiological studies might be interesting, but not for an individual necessarily that reliable. And taking statin medications, even when it lowers cholesterol, doesn't necessarily reduce all-cause mortality to the degree that people are thinking it does. And it does cause a lot of secondary side effects. I'm not a big fan of statin medication, particularly for people that, although their cholesterol may run a little higher than the average, don't have the other risk factors, okay? And you won't see somebody like Dr. Lyle with excellent dietary compliance, in our experience, developing atherosclerotic vascular disease. And there's other testing you can do that are maybe more sensitive. Like, for example, elevated CRP, like he mentioned, a much bigger predictor than would be endogenous, stable, elevated cholesterol. So it doesn't mean that we don't prefer to see cholesterol levels lower because they're statistically associated with a lower risk factor, but you have to take all of it into consideration when evaluating an individual's risk factor. Of course, I give Dr. Lyle a hard time because I tell him that piece of or a vegan carrot cake he has once a year, that's probably what's doing it.
What's in that carrot cake?
Yeah, well, who knows? It's vegan.
How in the world can you, is it still $149 a night to be here?
Well, it's actually, the lowest rate is $159, and it's for a couple. If you have a private room, it's $199. So we have comparatively very low rates, but we're also operated by the TrueNorth Health Foundation, which is a 501c3 nonprofit research organization. So we're actually a human subjects laboratory disguised as a clinic. So we don't have the pressures that other private organizations do, where they have stockholders and they have investors and they have to return it.
Well, you must save a lot of money on food because you don't feed anybody.
Well, we spend about $30,000 a month on food because remember, everybody that's fasting feeds, and we also feed our staff, many of which live on site. So we actually we have a very excellent kitchen. We have a chef, a sous chef, and half a dozen people that work in there. We buy a lot of produce. We support a lot of local farmers. We have a 2-acre farm. So feeding is a pretty big operation here. But while people are fasting, obviously they're not eating. But when they come off the fast, they eat plenty.
You have a hard stop in 8 minutes, and Michelle has a few questions. So if you don't mind, I'm going to switch seats here.
Hi, Dr. Goldhamer.
Hi, Michelle.
Thanks for hiring me.
Glad you're here.
I'd like to know, what is your overall goal for TrueNorth Health? How do you want to see it evolve?
Well, TrueNorth Health is trying to sponsor original clinical research. So one of the things we're trying to determine is how to do fasting most effectively, who responds well, develop non-invasive biomarkers so we can tell who should fast, when they're done fasting, and document the effects that fasting has. So that's a big part of our research agenda. We're also going to be enrolling a large number of people, probably somewhere around 2,000 people, in a study that's designed to monitor them for the rest of their lives and be able to help determine what types of behavioral intervention are most effective at preventing debility later in life. So we have some ambitious research agendas there. We have a new book coming out called Can Fasting Save Your Life that summarizes the research we've done to date and postulates what we think the direction research should follow. So we're very excited about that. That'll come out in 2024. And then we also have a public education component to the TrueNorth Health Foundation. We want to figure out how to support people in maintaining the diet and lifestyle changes when they go home so that we can get good long-term outcomes and they can be successful at preventing disease. We actually believe that the people that may get the most benefit from fasting are healthy people that have decided they want to stay healthy so they can have a good life and then a good death, where one day they go to sleep and don't wake up, rather than spend what is currently 9.6 years is the average amount of debility and 16 years of poor health. And during that 16 years of poor health is when people spend most of the money that's spent on healthcare, but without actually necessarily getting people to live longer or better. So we believe that you could see a really revolution in healthcare by getting people to stay healthy instead of waiting till they're sick and then treating their illnesses. We spend our money treating the leading causes of death and disability, heart disease, cancer, and stroke, instead of dealing with the actual causes of debility. The reason people get heart disease, cancer, and stroke is because they're eating a greasy, fatty, slimy, dead, decaying, flesh-based, highly processed food diet, not exercising enough, and using drugs. So we want to get people to do diet, sleep, and exercise to avoid the diseases and avoid the debility. And we believe that we need to do convincing research to help people understand that they're caught in a pleasure trap and that the only real answer is to escape the pleasure trap.
But how many of our patients actually stay out of the pleasure trap when they leave?
Well, it turns out that at least in the study that we did where we carefully measured this, 77% of those people had been able to avoid the pleasure trap enough that they were able to maintain their weight loss, they were maintain their normal blood pressure without medication. So that's almost 3/4, and that's without the benefit of the type of ongoing support that we're hoping to develop and the strategies that we can help people. It's very difficult for people to live healthy in a world designed to make them fat, sick, and miserable. And so everywhere they go, people try to give them what they want, not what they need. What they want is to indulge in their addictions. What they need is to figure out a way to escape the pleasure trap and still live and function in a society that's not designed to support them.
So what's your motivation behind all this? Because we know that we're running TrueNorth not as a profit-making machine, but to help enhance people's health. How do you avoid the pressure to turn this into a different kind of operation?
Well, my wife says the entire motivation is because I want to prove I'm right and everybody else is wrong. So that's probably what it is. It's probably a bit of a narcissistic, self-generated, selfish desire to prove that this model that I think is correct is actually correct. And the way we're going to do that is through proper research, documentation, and public education.
And what is the thing that gives you the most joy about working here?
Well, I think there's a lot of things. It's very gratifying to see people that come in with health challenges recover their health. It's also gratifying to see people, particularly long-term, that are healthy that stay that way. And they tell you everybody around them is falling apart, and yet they're able to maintain health. And everybody tells them they must just be lucky or have good genes. And in a way, that's true. I guess we'd call them designer genes if you think about it. So that's gratifying. We also have a unique, the 70 people that work for the TrueNorth Health Center are here largely because they believe in the mission that we're doing. They like working here. So it's pleasant to work around people that aren't idiots or assholes. And we have a bunch of people that are not idiots or assholes. And that makes coming to work very, I think, enjoyable. I think the other thing is that we have a really unique opportunity to implement something that's not at all accepted. So if you have a contrarian viewpoint, which I do naturally, Dr. Lau says that he did some testing with me and he found I have like 0 percentile in terms of agreeableness. So that of 100 people, 100 would be more agreeable on average than I would be. So for me, proving that this, which is totally rejected by a significant part of society, is right, and then being able to prove it's right, very gratifying. You know, it feeds that kind of personality. And so I think I think my wife is probably pretty much right. That is probably a big part of the driving force. And it may be, we'll find out, once this is really fully accepted, I may have to move on to something else.
Beating Dr. Lyle at basketball?
That is absolutely a key priority. I haven't been able to succeed so far, but I'm going to keep working on it.
I think that's objective number 1.
I'm really sorry to butt in here, but I have to know, your father taught you some kind of bizarre math.
Yeah, well, he told me the success to a successful relationship. And I just celebrated my 40th anniversary. So I think so far it's working. But he told me the secret to a successful relationship was to understand the math of marriage. He was a math teacher. And he said that the math of marriage is very simple. Women are right about 90% of the time. And men are right, well, not quite so much. So if a husband always agrees with his wife, he'll be right 90% of the time. And if you get 90% right, you get an A.
And you said your wife renews the marriage contract every year.
Yeah, last year I thought 40 years anniversary, I was going to ask her for a 2-year extension. Because I thought, after 40 years. But she said, no, 1 year at a time. That's all she's willing to do. So
yeah, and you also say that most females are 90% correct, but your wife is a 95%.
I have a 95%er. Yeah, in my experience, she's right 95% of the time. So there's not even any point in trying to argue with it.
That also makes you smart because you picked her.
I think not so much smart. I think that was a very wise decision.
Beautiful.
Yeah, I don't think you had to be too smart though. If you've met my wife, you'll know that.
I've met her. She's wonderful.
As I unclipped Dr. Goldhamer's mic, I told him, had I not seen it with my own eyes, I would never have believed that ordinary people, some of them aging and many with serious health concerns, could water fast for 40 days and see such dramatic results. Over the next few weeks, we'll post interviews with patients like Yvonne Velman, who is going on 9 years free of the stage 3 lymphoma she had before her 21-day water fast and new eating pattern. And we'll post an interview with Dr. Varesh. It's amazing what she's seen in her 10 years of working there. If you subscribe and smash the notification button, YouTube will let you know when those episodes are posted. Thank you.